Gum disease is a silent epidemic affecting nearly 90% of adults globally, yet most remain unaware. Early stages gingivitis show symptoms like bleeding gums and bad breath, but are often ignored. Left untreated, it progresses to periodontitis, causing irreversible bone loss. Shockingly, research links gum inflammation to systemic diseases, including diabetes and heart conditions. This scene reveals how widespread neglect fuels this preventable health crisis. Brushing-induced bleeding is your body's SOS signal, not a brushing mishap. When gums bleed, it means immune cells are fighting bacterial invaders, creating fragile new blood vessels. Studies prove 3 weeks of proper brushing can reverse early gum disease, yet 60% of people dismiss bleeding as normal. This mirror reflection shows a worried person ignoring blood in the sink, a critical missed opportunity for early intervention. Contrary to popular belief, gum recession isn't inevitable with age. Research comparing populations with different oral care habits proves gum health depends on maintenance, not years. In this split screen, a 70-year-old with pristine gums, left, contrasts with a 30-year-old smoker with severe recession, right. The real culprits? Plaque buildup and improper brushing, both entirely preventable through evidence-based techniques we'll reveal next. Microscopic view reveals the battlefield. 700-plus bacterial species form plaque biofilms at the gum line. These pathogens secrete toxins triggering chronic inflammation. Over time, this erodes the alveolar bone holding teeth in place, a process called periodontal breakdown. Surprisingly, just 0.5 millimeters of gum pocket depth increase doubles heart disease risk. This animation shows immune cells, white, desperately fighting orange-hued bacteria invading gum tissue. Clinical trials confirm brushing at a 45-degree angle toward the gum line removes 40% more plaque than vertical brushing. Soft bristles should massage gums, not scrub teeth. Here's why. Angled brushing disrupts bacterial colonies hiding in the sulcus, 1 to 3 millimeter groove between tooth and gum. Demonstrated on this model, proper technique involves gentle circular motions covering every surface. A free method outperforming expensive electric toothbrushes when done correctly. A 2023 Journal of Periodontology study found warm saltwater rinses reduce gum inflammation by 50% in 7 days. The osmotic effect draws out fluid from swollen tissues while salt's mild antiseptic properties inhibit bacteria. This bathroom scene shows 3 zero-cost solutions. 1. Half teaspoon sea salt in warm water. 2. Coconut oil pulling, ancient Ayurvedic method. 3. Cold-pressed aloe vera gel. All displayed beside pricey commercial products, they outperform. Documented case study shows remarkable healing progression. Day 1 to 7, reduced bleeding by 72% as inflammation decreases. Day 14, gum color transitions from angry red to light pink. Day 21, tightened gum texture as collagen rebuilds. Day 30, healthy 2 mm sulcus depth achieved. This time-lapse proves consistency matters more than products. Participants used only a soft brush, floss, and salt water. No professional treatments were involved in this turnaround. Harvard research reveals gum disease bacteria P. gingivalis travels through inflamed gum vessels, found later in atherosclerotic plaques. These pathogens trigger systemic inflammation, a key driver of Alzheimer's, via amyloid plaque formation, and diabetes by increasing insulin resistance. This anatomical animation traces the journey from bleeding gums to major organs, with red inflammation lines spreading to the brain, heart, and pancreas. Global traditions offer proven gum therapies. 1. Middle Eastern miswak sticks, natural fluoride and silica. 2. Chinese herbal rinses with honeysuckle. 3. African chew sticks containing antimicrobial tannins. 4. Indian neem twigs, azadirachtin fights plaque. 5. Native American cedar bark infusions. Modern science confirms these methods reduce plaque by 60 to 80%. This montage celebrates ancestral knowledge now validated by 21st century microbiology. Recapping the 3 free essentials. 1. Proper angled brushing. 2. Daily gum massage. 3. Saltwater rinses. Empowered individuals worldwide are breaking the dental industry's profit-driven cycle. This diverse group smiles while holding toothbrushes like swords against bacterial foes. Remember, gum disease is optional, not inevitable. As we fade to healthy gums from Scene 1, the message is clear. Start today, and in 30 days, your mouth and body will thank you.